Hi everyone! We have created this video in an effort to answer commonly asked questions regarding COVID-related PPE requirements. With us, we have our experts from infection control and our clinical nurse leader. So we have Janice and Wendy, both from infection control, and baby John, our clinical nurse leader. So Janice, if you can start us off with talking about proper PPE requirements for COVID-related patients.
Okay, so out in the hall, you can just wear a surgical mask. But if you're going to go into the rooms of a COVID positive patient or a PUI, then you want to put your shoe covers on. You want to put a gown on, and you can use a disposable gown or a washable, reusable gown. Then you want to put on your gloves, perform hand hygiene first, of course. And then you're going to wear an N95 in the room. And with that, you're going to wear either full face shield or goggles.
So there's been some discussion about wearing washable gowns. Can you help us talk about what would be best practice for us to doff the washable gowns?
Yes, there are people who are concerned about that. They're afraid they're going to contaminate themselves because they can't just break away with the gown. But anyway, when you put it on, for the tie in the back, make sure you do like a bow tie, like you're tying shoes, so you can easily untie it and you won't have knots. But then you want to remember as you're taking it off that the front is contaminated, and so not to contaminate yourself. But another thing that you can do is to have a buddy. You can come to the door and ask someone to come help you, turn around and let them untie it for you, and then you can take it off.
Can a COVID patient be placed in a regular room without negative flow?
Yes. A COVID positive patient or PUI does not have to be in a negative pressure room. Initially, when COVID got started, that was the guidance, but as we've learned that it's mostly droplet, spread by droplet, then we do not need a negative pressure room.
Can we change PPE between the same patients in a shared COVID room?
You don't have to. You can go from patient to patient, but you do want to change your gloves and perform hand hygiene.
What do I wear when I transport a PUI or COVID patient?
So when you're transporting a positive COVID or a PUI, you need to wear your N95, which you'd be wearing, and some gloves. The patient should be wearing a surgical mask. Now, in the situation where you might have to assist the patient while you're during transport, then you might want to wear a gown also. And there's also, you can also call escort to be like a marshal, and then they can go in front of you and open doors and, push elevator buttons and that sort of thing.
Is there anything special I need to do to the bed? Because, if the bed touches the elevator wall.
You can always wipe down the rails before you take them out of the room and cover the rails with a clean sheet.
So if a surge happens, there's been a lot of discussion that maybe it'll happen later, and we have a whole bunch of patients in the ED. What is the process for cleaning prior to admitting a new patient? How long does it require for cleaning purposes?
Admission of a new patient, the cleaning is the same as any terminal cleaning that we do. You can have the TruD. If the TruD is used, there's going to be a 45-minute wait. Now, if aerosol generating procedures have just been performed in the room, then we have clear times for how long the room, based on air exchanges, has to be cleared.
Do I need to wear a double gown if I'm going into the COVID positive rooms?
You don't need to wear a double gown. If you have to, if the patients are in a shared room, you can, as Janice stated earlier, you remove your gloves and perform hand hygiene between the patients, but you don't have to double gown.
How long can I use the face shield? Do I throw it away at the end of my shift?
No, you don't throw the face shield away at the end of the shift. You can use it as long as it's in good condition, the strap isn't broken, that sort of thing. You just got to make sure you disinfect it, after every use.
What PPE do I wear if I go from room to room? So if I go from a COVID room to another COVID room, what PPE do I wear?
Okay, what you're going to do when you go from one room to the other is you're going to remove your gown and your gloves, but you can leave your N95 on and your face shield or goggles and go to the next room. And then there you would, perform hand hygiene and don your gown and gloves to go into the room.
What if I'm going from a PUI room to a COVID room?
It'd be the same procedure,
Okay, and then if I was going from a COVID room to a PUI room, that would be the same?
same.
Okay. Can I wear the shoe covers out in the hallway?
No, you don't have to wear the shoe covers in the hallway, but in the patient's room, you should always wear the shoe covers and remove it before you leave the room.
If I'm going to take out the trash or the dirty linen out of my room, does it need to be treated any differently? Should I be double bagging, or should I wear
No,
proper
the-
PPE?
The trash and the linen is treated as any other patient's trash or linen. In fact, there's not any special requirements that all the trash has to be on biohazard. But I know I do understand that some areas are taking the trash, like there'll be one person in the room and then there'll be a clean person on the outside with a bag, and they'll put the bag in there and double bag it that way, and then the other person will take it to biohazard room, wherever, and that's fine. It's just not required double bagging.
And the trash does not need to be red bag biohazard trash.
Does the elevator need to be cleaned after a COVID patient is transferred?
You don't have to unless there is any bodily fluid spill in the elevator, but otherwise, as they stated, you can wipe down the rails and put a clean sheet over the rails before you transfer the patient. But of course, if there is any spills, you may have to clean the elevator.
What do you guys recommend is the best way to store my reused PPE, like my goggles or my face shield?
You want to save your the N95 mask in a paper bag, open paper bag, but your face shield and the goggles should be saved separately, either in a paper bag or you can hang them. We have hooks on the computers, on the cows, so you can hang them after cleaning on those hooks. But your N95 mask should be in the paper bag.
And if I'm taking care of a COVID positive patient and they pass away, how do I need to treat the body? Like, what's the postmortem care requirements?
There's nothing different than other postmortem care, except for you're going to have on your PPE when you're taking care of the patient after you put them in the body bag. And we do have body bags that are considered the proper thickness. But after you put them in the body bag, you wipe down the body bag with a disinfectant. Other than that, there's nothing special. But we do have an SOP on that, and it should be in the unit's resource binder.
All right. I hope this video is helpful to you and have answered your commonly asked questions. Thank you so much and have a great day.